in terms of the daycare piece, I can't have them in a center. In a toddler room, they would be among, oh God, what did they tell me? Something like 15 other kids. In an infant room, they might be among 10 other kids. In a home daycare, maybe there's a max of 5. I can't risk that. Alexa's still being on oxygen at night, yes. But she's still, someone needs to monitor her color. Like, how would they know? They need to know what cues to monitor for in case she starts breathing rapidly, or you have the nasal flaring, or this and that, right? Then they have their hearing piece that someone needs to be comfortable with. They go for special, it's called AVT, audio verbal therapy. It just helps to encourage them to listen. But again, it's an interactive thing that the parents need to be a part of, or grandparent, whoever the caregiver needs to be involved in. But it requires special play with the girls. There's, the comfort level about changing batteries, about reinserting hearing aids, about trying to ensure that their motor skills and such, like the different, activities that, that they're engaging their core muscles and that kind of stuff. So there's all of this. So who do you get? And also we were told too by the region that we would qualify likely for subsidy given the income or the lack thereof that we took in last year. And but the problem is that to qualify for it, you have to have your kids in either a licensed childcare facility, in-home, or a center, which I can't do. So since that time, we've been fortunate that the manager of the Halton Region Infant Development Team has come out. She came out with her staff on a home visit, met the girls, and I talked about both my advocacy piece and the lack of appropriate childcare in the region and, in the province too. And she has since spoken to her director and has agreed that they could apply the subsidy to, I guess the partial subsidy or whatever we qualify for, to provide care for the girls in home. But where do I go about finding the person? I also have to ensure that this person, for example, does not have other children, that they aren't taking public transit, because, Lord knows what you could be exposed to. There's just so many pieces to the puzzle. And again, this is not forever. This is like for 1 year that I would need this specialized care. I just am stating, I'm trying to kind of make it publicly known that there is nothing out there for, medically complex or technologically dependent or immunocompromised kids. My mother-in-law, God love her, she is doing an incredible job with these girls. And, she's in her 60s. And to be providing all this care 5 days a week for, say, 9 or 10-hour days, that is so much to ask. Yes, she's been agreeable, and thank goodness, and the girls just love her. But where do I turn to? My girls are immunocompromised. I don't know who I would want. A nurse, fine. I don't think they need that level of care. I don't think they necessarily need the level of care of a PSW. But then you have, say, an early childhood educator. They may not have the medical piece. They may not have the familiarity with the hearing loss. Like, I don't know, right? So it's like you need the best of multiple people. And I don't know. I don't know where you go about finding somebody. And frankly, I don't know that I have the time to do it. I'd love to, work part-time or be able to do that and to be home. I can't see myself just with my own social isolation, and I think for my own mental health, I think keeping my foot in the door from a working perspective is important. In a lot of cases, I think people just don't go back to work, and there's no government support for that. Because the thing is, you're no longer in a state where your kids are at risk of imminent risk of dying, right? Where you would qualify for those specialized benefits. And that's only 6 weeks, I think, for compassionate care leave. There's, funding support for people who choose to stay home to help out with an elderly family member who requires care. But I don't think that the government takes into account what's required. Like, I look at my kids and their their needs are nothing in comparison to what, the needs of your son or many other kids who might be at home on ventilators. And what do those parents do, And what support programs are there? Unless your child is deemed palliative, I don't think there's anything. And I think families just make do. Either they make do in the sense that they, live paycheck to paycheck, or they, some work part-time in the evenings and they just kind of flex the schedule so that there's always somebody home with the kids. But I don't know. I don't know what there is no simple answer.